Good morning, good afternoon, good evening to all participants of the second day of this year IDM with the title of Accelerating Integrated Action on Sustainable Development, Migration, the Environment and Climate Change. Normal IDM always had something what we call migrant voices, that we can actually bring the voice of the migrant to auditorium to you, our dear participants. The today video that we'll start with is called Find a Way. As IAM is the forefront of action, helping climate migrants find a way to rebuild their lives with a dignity and be resilient to the future shocks. The Find a Way individual giving campaign presents 5 stories, 3 countries, about the 2 biggest challenges of our time, climate change and migration, and calls for donation for continuance of their work. If you would like to see more about our 5 heroes from Bahamas, Madagascar, Mongolia, Myanmar, or Micronesia, please visit our website. Now we'll watch the campaign trailer.
The earth is changing. Summers are getting warmer. Winters are much colder. Hurricanes, floods, storms, and droughts are increasing in intensity. The climate is changing, and many people are being forced to move and adapt like never before. In the face of adversity and nature's fury, we need to find a way to protect, preserve, and persevere. Join IOM in helping people around the world be more resilient to climate change. Together, we will find a way.
Now I would like to give the floor to our DMM director, Ms. Monica Goracci. Please.
Thank you, Dejan. Good morning, afternoon, and good evening, and to all of you, and welcome to the second day of our IDM. We will start the day with a discussion on understanding the linkages between migration, environment, and climate change, MECC, and migration health in the context of COVID-19, and promoting the inclusion of MECC dimensions in COVID-19 recovery efforts. In 2020, our IDM looked at the COVID-19 crisis with a focus on reimagining the role of migrants and human mobility in the achievement of the Sustainable Development Goals. A year later, we're here to look at the impact of COVID-19 on migrants and internally displaced persons in the context of the adverse effects of climate change and environmental degradation. Climate change does not stop during a pandemic, so it needs to be addressed as part of socioeconomic recovery post-pandemic. While reduction in atmospheric pollution may have been registered due to the limited activity, climate change requires really sustained and long-term mitigation and adaptation efforts. A month ago, on the occasion of International Mother Earth Day, the UN Secretary General launched the 6th Action on Climate Change and urged nations to recover better, showcasing the commitment of the UN to make sure that climate change and COVID-19 crises are addressed coherently. And in this respect, migration, climate change, and the health nexus should be prioritized in joint actions across environmental migration and migrant health work streams. More and better data is required for this on the intersection between the pandemic response plans for recovery and climate change. So we will discuss today and we'll look at how can we learn from this pandemic in relation to migration health and the environment to really recover better and contain future outbreaks. And we will do that with 4 speakers. We will start the discussion with Dr. Maria Neira, Director, Department of Public Health, Environmental and Social Determinants of Health. Dr. Neira will provide the perspective of WHO's work in the areas of health and migration, as well as its interlinkages with the climate change and environmental health issues. Dr. Neira, you have the floor.
I'm sorry, Dr. Nira is not here yet. Can we move to the next speaker?
Sure. Then I will like to pass the floor to Dr. Ibrahim Abubakar, Chair of the Lancet Migration and Climate Change and Migration Lead and Director of the Institute for Global Health, University College London, who will bring the Lancet's extensive engagement on both climate change and migration health issues. Dr. Abubakar, you have the floor. I've seen you. So.
Yes, I hope you can hear me too.
Very well.
Thank you, and thank you very much indeed for asking me to make an intervention on this really important subject of the health consequences of anthropogenic climate change-induced population mobility and indeed entrapment of many populations. As you've alluded to, I am the director of the UCL Institute for Global Health, and we are lucky to host both the Lancet Migration Initiative, which I chair, as well as Lancet Countdown, which is an entity that is working with a range of partners to provide measures on how well we are doing around the subject of climate change and its specific impact on health. Our Lancet Migration Report, published a couple of years ago, demonstrates that human mobility and its consequences are indeed really straightforward. Estimates of population displacement due to environmental factors are indeed very varied, depending on the source you look at, and they range widely from about estimates that are just about 25 million people affected, all the way to others that believe it's up to 1 billion people by 2050. And most of this is happening in the global south. The statistics are dire, whichever source you look at. For example, the recent report by the International Federation of the Red Cross and Red Crescent Societies estimates that 12.6 million people have been internally displaced globally, mainly due to climate change and weather-related disasters in just the 6 months period before March 2021. So right during the pandemic, 12 million people displaced. UNICEF just published a report yesterday and concluded that in 2020 alone, 9.8 of the 30 million new weather-related internal displacements affect children. So they squarely placed this issue in the context of child rights emergency. Migration, climate change, and health are complex systems with multiple drivers. Consequently, when we look at health outcomes and in our evidence reviews with the Lancet, we realize it's dependent on differential exposure to these insults, sensitivity to the insults, vulnerability of the populations affected, and how the adaptive capacity of the populations to change. But they are also mediated through social, economic, political, and demographic factors. So clearly, any attempts to look at the interface of these three factors must take into account the complexity of each of these systems. And complicating this is that any assessment also needs to take into account people's response to the insult of climate. And what happens is people may move away if they have the ability to, or they may get entrapped and cannot move, or indeed they may move towards the disaster because there are job opportunities there and they have to find a way on livelihood. In my intervention, I'd like to draw on 5 key areas, drawing on the idea that the Lancet Countdown initiative has of trying to measure how well we are doing as a planet and as individual countries in meeting the needs around climate, health, and migration. So first, I'd like to touch on the extent to which health or well-being are considered in national policies that connect climate change and human mobility. Up to December 2019, so that just pre-pandemic, we were able to identify 43 national policies in 37 countries that connected climate change and migration. Only 40 of these explicitly reference health or well-being, although typically in relation to the health impacts of climate change, not in relation to the potential impact of health on displacement, and rarely was immobility, i.e. entrapment of populations, ever acknowledged. So it looks like very few countries and very few contexts actually take into account in their national policies these 3 issues that we are talking about. Second, an important issue is rising sea levels, not least because that's probably going to be the first factor that we are all going to face. It is projected that about a proportion of countries would be, especially those in coastal areas, would reach 2 meters above current sea levels within the next 80 years. and there will be more areas affected. Indeed, areas that are not coastal and more spread in the hinterland will ultimately be affected by other forms of intermittent flooding, by storms, by salinification of soil, as well as outbreaks of infectious diseases. The Lancet Countdown Initiative estimates that there are currently 145 million people living in coastal areas that are within less than 1 meter above current sea levels. And indeed, a further 565 million people are settled in areas less than 5 meters above sea level. So this large population is at a serious risk that within our lifetimes may actually become at risk of the effects of climate change and ultimately displacement and impact on their health. Third, drought. So we know that climate change is making areas of the world drier, and we know that it is also making wet areas wetter. The intensity, duration, and frequency of drought is increasing due to changes in rainfall patterns and temperature. Drought threatens drinking water supplies, it affects sanitation, it affects crops and livestock productivity, and it enhances the risk of wildfires in such a way that ultimately it may increase levels of forced migration. At Lancet Countdown, where we track the effects of this, the indicator that is in use is one that tries to combine both precipitation, i.e. rainfall, and temperature, including its impact on loss of soil moisture. Analysis of this data are ongoing, but early signals indicate that since 1990, the percentage of the world land area covered by extreme drought has increased. And the effect of this is most evident in the Horn of Africa, in countries like Kenya. Fourth, food insecurity and its ultimate impact on population mobility. This is a particular concern due to increasing temperatures, ground level ozone exposure, and reduced labor capacity in the agricultural sector, potentially exacerbating places where there is famine. At Lancet Countdown, we track the impact of rising temperature using an indicator on crop yield potential. As a result of rising temperature, we have evidence to suggest that the yield of crops such as maize, winter wheat, soybean, and rice continue to decline, suggesting that there's a future risk that populations at risk of famine will be adversely affected, and global production and country level production of this essential foodstuff will be affected. Fifth, climate change is increasing in its lethality, and the likelihood of extreme events are also increasing, including wildfires and other extreme events more broadly. And depending on their frequency, intensity, and level of destruction, we know that this increases the propensity for human beings to want to move away and relocate. There has been a statistically significant increase in the number of weather-related events between the 1990s and 2019. Interestingly, and this is very worrying, the differential effect, according to analysis done by Lancet Countdown, is that places in the world where they've been able to invest in health, actually, despite an increase in the number of events, are doing very well, so that people affected are decreasing in number. Whereas countries that are poorer and or have not invested in health are having the effect on people increasing over time. This is a precursor for the inequality that climate change will bring on health. Similarly, with wildfires, Lancet Countdown reports that an estimated increase in risk in 114 of the 196 countries examined in the period 2016 to 19, compared to 2001 to 2004. And the increase is most prominent in specific countries such as Lebanon, Kenya, and South Africa. But as we've seen in the last year in the news, Australia, USA, and other places around the world are affected by increasing levels of wildfires. So I'd like to conclude my intervention by highlighting that I believe the solution lies in immediate action that is multi-pronged and cross-sectoral. We must ensure a pre and during and post-migration response to the health consequences of climate-induced human mobility and entrapment. We need to support further research to generate the evidence that we desperately need around the migration, climate, and health nexus. And we need that not just data on the effects, but also of interventions. We must continue using excellent frameworks that exist, including WHO's Health Emergency and Disaster Risk Management Framework. And we must create health systems that are both migrant-friendly and sensitive to the climate crisis. both in their preventive and curative functions. Ultimately, and my final point is this, that cutting emissions in excess of agreed global targets is the answer. Failing to do so is the ultimate species level suicide in slow motion. Thank you.
Thank you very much, Dr. Abubakar, for this word. We spoke about the need for evidence, so thanks for this perspective, reiterating the need for reliable information and for sharing with us the Lancet Countdown initiative, showing how much we need to really connect the different dimensions. I don't know if Dr. Neira is online. I know that today we're coinciding with the third day at the...
She's online.
She's online. Okay, then I have already introduced you. So without further ado, I give you the floor.
Thank you very much, and apologies for these last minute changes. And as you know, we are in the middle of the World Health Assembly, so I think we have a very good excuse. But of course, we found this meeting very important. Thank you very much for the invitation and appreciate this opportunity to talk. Obviously, as you well know, at the moment, one of the main concerns of the World Health Organization agenda and the World Health Assembly agenda is exactly that. How can we be better prepared and better response if the next crisis will affect all of us as a society, as a humanity? And one of the crises that is already there, we don't need to wait for it, and we don't need to even anticipate or early detect, is the climate change. We have been working on climate change and health for very long now. Actually, one of the first reports of WHO about climate change impacting our health is more than 30 years ago. And since then, we have been very much attending all the COPs, all the climate change summits, because we recognize that climate change and health are absolutely intrinsically linked. And particularly for this Glasgow COP26, we need to make sure that we bring the health argument. I think that the previous speaker, Dr. Ibrahim, I think Abubakar, he already displayed what we have been putting on the table for a long time in terms of how climate change will affect our health. Directly and indirectly, it will touch the three pillars of our health, which is access to food, the air we breathe, the shelter, and the water we drink. If you tackle, if you destroy those four pillars of our health, clearly that will generate difficult conditions for people, and they will displace, and they will move, and they will look for better conditions for that. In addition, by the global warming, obviously, you will create better conditions as well for vector-borne diseases and like malaria and dengue and others, but lack of access to sources of food and safe water. Therefore, let's look now at what do we do. I think we have plenty of arguments demonstrating that climate change is big crisis that is already affecting us, and we need to recover post COVID-19, including some recommendations that will make a triple benefit for health, for the economy of the society. And one of them is clearly recognizing that if we tackle the causes of climate change, we will generate immediately health benefits for the people. So one of the best actions we can put in place is to push and pressure on the countries, the member states that will be meeting in Glasgow this year, and kind of putting all of our arguments from the migration point of view, from the health point of view, and saying the best we can do for that is to really increase the level of ambition on the actions that we need to take to tackle the causes of climate change, and the speed at which we will do it. During the last weeks, I'm sure that you all heard the different statements by the G7 and the G20, where they made very serious commitments about even the International Energy Agency was saying if we want to obtain this no more than 1.5 degrees centigrade degrees increase, we need to stop this year, not by 2030 or by 2050. This year, we need to stop the new developments of coal, oil, and gas plants. So that's a very strong statement coming from an energy agency that has been promoting different sources of energy. We need to do this transition to renewable and healthy sources, clean sources of energy very, very quickly. But even if we do all of those transition to a healthy food system, transition to healthy sources of energy, transition to healthy urban planning, all of these three are critical. Plus, of course, stopping our destruction of the ecosystems and the biodiversity. If we are facing this pandemic now, is partly because we have been destroying the barriers between animal health and human health and creating a pressure on our ecosystems, doing deforestation, doing very aggressive agricultural practices, and therefore we are creating the perfect conditions for any emerging infectious agent to spill and spread. So we need to tackle and stop this destruction to nature. But even if we put all of those measures in place, if we implement the national determined contributions, which are the plans that every country is now describing as their commitments for climate change, we need to adapt. We need to be prepared for some adaptation to climate change, and we need to be prepared with the fact that there will be massive displacement, there will be migrants, and there will be people escaping these already terrible conditions created by climate change. And therefore, as the health system responsibles, we need to make sure that those health systems that we have in place at the moment, they are more climate resilient and they are more environmentally friendly. We have developed guidance on that, and we will really appreciate if you can help us to make sure that whenever you work on a health system or a healthcare facility, or you contribute to accommodate the displaced people or the migrants on a healthcare facility, they need to incorporate all of those requirements for becoming more climate resilient and climate change adapted. The other thing is that we need to make sure as well that because there will be a migration and because there will be a displacement, how can we make sure that the existing healthcare facilities will be able to absorb this increase of the population? We need to make sure that there will be, we know from now that there will be more cases of malaria in places where we didn't see malaria before, in the mountains of Kenya or in other places. There will be more cases of dengue. And if we have this displacement of population, how and who will cope and absorb this increase of the population affected? So while we probably invest as well on emergency system, on humanitarian systems to protect all of those displaced people and migrants, we need as well to make sure that the health systems of the cities or the rural areas are better prepared now to absorb a movement that is already taking place and is generating an increase of demand on the population. At COP26, we will be, as WHO, presenting what we call the health argument for climate action. We will be happy to include into that any suggestion that you might have in terms of how climate change is affecting our health and how it's contributing to this massive displacement and so-called climatic refugees. I know that there is not yet an accepted term, but people who is displaced because the global warming is forcing them to move. So we are, as I say, a big report on the health argument for climate action, how climate change is affecting our health, but most importantly, how by tackling the causes of climate change, you can obtain massive health benefits, you can stop this massive displacement and migration, and how you can benefit as well the economy, and why we needed to do it quicker and on a more ambitious way. So very much happy to join forces on that. We can share with you the architecture of this report, and we want as many associations, organizations, and groups as possible to join this movement on putting common sense back on the COP. and particularly giving the strong arguments why we need to do to stop these climate change causes, and at the same time to adapt for those who are already affected and they need better conditions to cope with. Thank you.
Thank you, Dr. Naira, for being with us despite the busy agenda of WHO these days, and for sharing this perspective and this call to urgent actions from different sides. IOM has collaborated with WHO on climate change at climate change negotiations very closely on the social dimensions of climate change for over 15 years now. So we'd be very happy to support you for the development of the health argument on climate action at COP26, and we look forward to be joined by as many actors as possible, as you say. So thank you again for your contribution.
Thank you. Mm-hmm.
I now pass the floor to Mr. Kristof Tamas, Senior Advisor, Ministry of Justice, Division for Migration and Asylum Policy in Sweden, who will focus on international cooperation towards improving our common understanding and actions in regard to the linkages between migration, environment and climate change, and promoting the inclusion of MECC dimensions in COVID-19 recovery and insights in the Swedish perspective. Mr. Tamas, you have the floor.
Thank you very much. Thank you for inviting me and for the opportunity to address the IDM today. Climate-induced migration and displacement is on the increase and needs to be addressed with active measures and enhanced international cooperation. It needs to be linked to the implementation of the SDGs. I will first discuss the complex interlinkages between climate change, migration, health, and the COVID-19 pandemic. Then I will give some examples of what the donor community, including Sweden, can do, both in the short term and the long term. The ongoing global COVID-19 pandemic and its negative impacts on the provision of health services and on economies and labor markets around the world has put additional burden on those already affected by climate change and the environment. In both cases, the hardest hit are the most vulnerable, including migrants in both developing and developed countries. Millions are displaced annually as a result of floods, droughts, desertification, sea level rise, and more. According to IOM's migration data portal, in the first half of 2020 alone, 10 million people were displaced due to environmental disasters. The Internal Displacement Monitoring Center recorded an average of almost 23 million people newly displaced annually each year during the period 2009 to 2019. This adds up to almost 3 times the number of people displaced by conflict and violence. Currently, India, Bangladesh, the Philippines, China, and Somalia are among the most hard hit. Measures to contain the COVID-19 pandemic through travel restrictions and border controls led to reduced cross-border travel, reduced numbers of asylum applications, and reduced resettlement and repatriation of refugees. In parallel, such measures might have contributed to more internal displacement. In some countries, there has been an increase in conflict and violence-driven internal displacement during this period. For example, Cameroon, Mozambique, the Niger, and Somalia. The COVID-19 pandemic has also complicated the management of sudden displacement, including evacuations during disasters, where it is hard to follow advice and regulations on physical distancing and quarantine. Also, when restrictions on mobility were not a major issue, forcibly displaced people lived in overcrowded conditions, for example, on the island of Lesbos in Greece and in the Rohingya camps in Bangladesh. This contributes to higher risks among displaced people contracting the virus. There has also been new displacement due to the COVID-19 pandemic. For example, in Yemen, where 10,000 people moved away from COVID-19 hotspots, both to avoid infection and to leave behind the negative impacts on services and the economy. Already limited capacity in general healthcare is also negatively affected by COVID-19 patients, which in a South-South perspective can lead to tensions and add to already strained relations to migrants among the native population. In this context, it is also important that the COVID vaccine can reach developing countries and the most vulnerable. Another aspect concerning general healthcare is that many of the migrant workers were disproportionately affected by the pandemic, as they worked in sectors which the pandemic hit harder and where protections were minimal. This both led to increased vulnerabilities and in some cases that migrant workers lost their jobs to a larger extent than natives. Also, migrants were contracting COVID-19 to a larger extent. For example, migrants who normally abound in the health sector. Also, those in sectors characterized by temporary, unprotected work, for example, domestic and agricultural workers in the informal economy, often lack access to social safety nets and healthcare. The SDG goal number 3 on health has been affected more broadly by the pandemic. For example, as childhood immunization programs in about 70 countries had to be interrupted. COVID-19 has also led to healthcare interruptions that reversed decades of work to enhance healthy lives among the vulnerable. For instance, there is an expectation that we will see hundreds of thousands of additional under-5 deaths during 2020, as well as a 100% increase in malaria deaths in sub-Saharan Africa. One lesson learned from all this is that we need to distinguish between the short-term and the long-term perspectives. Post-COVID recovery plans need to incorporate the long-term implications that we can start preparing for already now. For the remainder of my intervention, I will focus now mainly on climate-induced migration. Firstly, climate change and natural disasters can have several short-term consequences on migration and displacement. High intensity and sudden natural disasters can result in short-term migration. Secondly, long-term consequences of climate change may also affect migration. The World Bank has forecasted around 143 million internal migrants by 2050, if nothing is done already today. It reports that extreme heat, drought, and variation in precipitation will have a growing impact on migration patterns, especially affecting communities where agriculture is a major source of livelihood and income. And this is why vulnerable regions and developing countries are hit hardest by climate change. However, the relationship between climate change, migration, and disaster displacement is very complex. And of course, if we add the pandemic and the healthcare systems, it's becoming even more complex. Many different factors affect migration, and there are both economic, social, and political drivers. Research in this area has come a long way, but it is not clear yet exactly to what extent and how climate change affects migration. It is nevertheless clear that climate-induced migration so far mainly takes place in the form of internal migration, and in the case of cross-border migration to nearby regions. The negative impact of the pandemic on the most vulnerable persons, including migrants, should be part of the increasing attention, both nationally, regional, and internationally, to climate-induced migration and displacement. Sweden welcomes the work of international organizations such as IOM and UNHCR, and that both global compacts on migration and refugees, respectively, address this issue. The SDG Goal 3 regarding health could also be explored to work on interlinkages between climate-induced migration, post-COVID recovery plans, and healthcare provisions. The major active measures against climate-induced migration and displacement include prevention, preparedness, adaptation, resilience, and planned relocation. The platform on disaster displacement recommends measures to reduce hazards, reduce exposure, and reduce vulnerability. The capacity of actors in developing countries and regions, for example, in terms of operational preparedness, should be reinforced through international cooperation. Post-COVID recovery plans should take the longer-term implications and lessons learned into account. The Global Compact on Refugees notes that climate, environmental degradation, and natural disasters increasingly interact with the drivers of refugee movements. Furthermore, internally displaced in the context of disasters have many similar protection and assistance needs as IDPs in conflict situations. These include the need for durable solutions. As we all know, however, there is no international legal framework in place for climate-induced displacements across borders. So climate-induced migration and disaster displacement often needs to be considered as a development and humanitarian issue rather than one of international protection. Strengthening preparedness is key. Donor countries can have an impact through development cooperation and humanitarian assistance to alleviate the pressure on affected communities. Through our development cooperation, Sweden, for example, works to strengthen the resilience in affected societies. A concrete example relates to access to water, which is necessary for people to be able to remain in the places of usual residence. The humanitarian development nexus should be strengthened through enhanced international cooperation, including through innovative financing mechanisms. Implementation of Agenda 2030 and the 17 SDGs plays a key role. A more resilient community will have a better condition to welcome new people to their societies as well. For more effective interventions, we need improved data on climate-induced migration, although this is challenging. Firstly, there is a lack of quantitative data on both internal and cross-border climate-induced migration and displacement. Secondly, there are often multiple drivers as to why people migrate. Consequently, it is hard to identify situations where the climate is the main or sole factor triggering migration. Sweden pursues a wide-encompassing climate policy aimed at preventing climate change and acknowledges and prioritizes the vulnerability of women and children who are disproportionately affected by climate change and its consequences. And Sweden is supporting international cooperation, for example, through UNDP and the UN Office for Disaster Risk Reduction. Sweden increased its overall ODA by 17% between 2019 and 2020 due to contributions to the Green Climate Fund. The fund was set up to limit or reduce greenhouse gas emissions in developing countries and to help vulnerable societies. In conclusion, increased cooperation bringing together humanitarian aid and long-term development aid is crucial for creating sustainable solutions. This IDM session also demonstrates how complex challenges we are facing and that we need evidence-based policies as the basis of international cooperation. Thank you.
Thank you, Mr. Tamas, for reminding us that in no matter what context, the hardest hits are always the most vulnerable, including migrants in both developing and developed countries. And also for reassuring us that as an important donor, that there is understanding of the need to invest in resilience for longer term solutions. And in the HDPN, the next panel in the IDM will focus on this. And also thank you for reiterating the importance of migrants' access to vaccinations wherever they may find themselves. This is a priority for our Director General and a priority for IOM in its COVID response plan for 2021. So thank you again for your intervention. I will now move to our next speaker, Dr. Elizabeth Ferris, who is a research professor at the Institute for the Study of International Migration at Georgetown University School of Foreign Service and adjunct professor in the Georgetown Law School, who will bring her academic and policy knowledge on the impact of COVID-19 on internal displacement within the context of climate and environmental change. Dr. Ferris, you have the floor.
Thank you very much. And thanks for the opportunity to speak with you today about some of the relationship between global response to the COVID-19 pandemic and to climate change-induced mobility. I also wanted to say, as an academic researcher, how much we appreciate IOM's work in this field. The Environmental Migration Portal, the work you've done on the analytical snapshots, looking at the impact of COVID-19 on migrants have been greatly appreciated within the academic and civil society communities. We don't often have an opportunity to thank you for this kind of work, but please know that it's appreciated. So in my short remarks, I'd like to focus on the lessons that COVID-19 pandemic offers, and particularly the global response to it, to our thinking and our actions on climate change-induced mobility. Like COVID-19, climate change is a global crisis that affects every single person on this planet. One of the themes of last year's IDM, and constantly stressed by the UN Secretary General, is that no one is safe until everyone is safe. We live in an interconnected world where actions taken in one country can have repercussions in communities across the globe. This is true of pandemics, and this is true of climate change. Our still evolving experiences with the pandemic offer lessons for confronting climate change, and particularly the likelihood that the effects of climate change will increase the movement of people. In spite of alarming projections about the potential scale of these movements, most of which will be internal rather than cross-border, as several have emphasized, this does not have to be a crisis. Global risk requires global solutions. Governments have to work together to address global threats. As the Independent Panel on Panic Preparedness in its report just 2 weeks ago said, the panel, quote, found weak links at every point in the chain of preparedness and response. Preparation was inconsistent and underfunded. The alert system was too slow and too meek. The World Health Organization was underpowered. The response has exacerbated inequities. Global political leadership was absent. We can say pretty much the same thing about the global response to climate change-induced mobility, but we do have time. For at least the past decade, there have been warnings that the effects of climate change will lead to large-scale population movements. We're already seeing increased movement of people due to the effects of climate change, both the increasing frequency and severity of sudden onset disasters and the relentless onset of slow onset hazards. People are moving now because of climate change and are likely to move in far greater numbers in the future. This is not a crisis. People have always moved because of environmental change. Migration can be a form of adaptation to the effects of a changing climate. But just as the fact that the world was unprepared for the spread of coronavirus, so too we are unprepared for the large-scale movements of people due to the effects of climate change. Experts, as we've already mentioned, expect most people to move within the borders of their countries, and particularly to urban areas. The UN High-Level Panel on Internal Displacement, where I'm serving as one of the advisors, is grappling with the issue of how to encourage governments at the national level, at the local level, to begin thinking and planning now for the movement of people, from communities where people will have to move because of the effects of climate change, and to the communities that will likely receive them, including the possibility of planned relocations. When areas become uninhabitable, and as a last resort, whole communities have to move. The record of planned relocations is not terribly positive. Are there ways that we could think now and put in place now means of facilitating this movement in a way that respects the rights of all? Many international agencies, including IOM, UNFCCC, World Bank, and governments, many academic, civil society actors are already engaged in making predictions and recommendations about the scale and characteristics of climate change-induced mobility. But there's little coordination between these efforts. We need more global cooperation to pull these efforts together. to offer sound guidance to government, to develop multilateral tools that can respond to the challenges that are coming. These disparate efforts, important as they are, seem to indicate an ad hoc, uncoordinated response to climate migration. And we've just seen that with respect to the pandemic. So we should heed the experience of the pandemic these past 18 months, particularly the importance of relying on science, educating the public to counter misinformation and even denialism. One of the effects of the pandemic, as we've seen already in this panel, has been its disproportionate effects on women and marginalized groups, migrants. We've seen increasing stigmatization, xenophobia. So too, climate change is likely to affect vulnerable groups, people living in marginal areas, indigenous communities. We have seen that COVID-19 has led to increased vulnerability in environmentally fragile areas, which are also often areas affected by conflict, poverty, high rates of forced displacement, and weak health systems. It has also increased the vulnerability of the so-called trapped populations, people unable to move. This is also a likely effect of climate change, as the UK's Foresight report warned us a decade ago. There are other lessons that the pandemic offers us as we confront the reality of climate-induced migration. Global pandemics and climate change both impact people's livelihoods with devastating consequences for both individuals and societies. As Bill Gates has written, climate change can be just as deadly as the pandemic, and the economic costs could be far, far higher. It is, of course, always easier to mobilize a massive response to a crisis once it occurs. It's more difficult to put into place systems to reduce the risks of disasters, whether they're pandemics, wars, or climate change. But as the former executive secretary of UNFCCC, Christiana Figueres, remarked, the current crisis can encourage systemic changes and highlight the need to focus on prevention, support the most vulnerable, and trust science-based solutions. We still have time now to take actions which will prevent climate change migration from becoming a global crisis. To close with the words of the independent panel on pandemic preparedness, we have been warned. Thank you.
Thank you, Dr. Ferris, for highlighting these important interlinkages and the need for better evidence, but also for raising the question whether we really need a crisis to act, or we can invest in preparedness and risk reduction efforts. And for leaving us with these words, we have been warned, which I would complement with maybe with the words of our migrant voices earlier on. So let's find a way. I think that will be important at this stage. And so thank you very much. And finally, our last panelist, Ms. Verena Knaus, Global Lead Migration and Displacement at UNICEF, who will focus on climate migration and its impact for children in the context of COVID-19 and recovery efforts. And among others, she will also highlight the joint IOM-UNICEF Action for Children Uprooted by Climate Change. Verena, you have the floor.
Thank you very much, Monica. Just to check, can you hear me all right if I speak like this? Okay, fantastic. Thank you very much, and also thank you to my co-panelists. It's very hard to add much because a lot of the issues that I was planning to address have already been touched on by Kristof, by the last speaker, by all of you really. So let me maybe sort of take the shortcut here and in a way recap some of the important points from a child's perspective that have already been mentioned and highlighted, and then run and jump right into 4 things that I think we can do, we should do, we must do, and that again have already been said, but maybe I put them on the table again for provoking already the discussion that will come after. So the obvious has already been said, that community health, migrant health, public health, climate change, and human mobility are intricately linked. One of them doesn't do well, there is an impact across the board. And obviously, as already said as well, children are disproportionately affected by all 3 issues. In a way, children are like the canary in the mine. If climate mitigation policies work for children, if health services are accessible to all children, regardless of their migration status, so IDPs and irregular migrants, refugees, and if mobility is safe and productive for children and families, these policies work. Everyone is better off. And if they don't, then we have a problem. So obviously, as children are disproportionately affected by the triple impact of climate change, of badly managed or unsafe mobility options, and of poor health infrastructures, we see this in the numbers. And I think our colleague from the Lancet had already highlighted the figures that we just put out recently of literally nearly 10 million new weather-related internal displacements of children happening last year. They didn't stop when the world stopped moving in the course of the pandemic. 10 million children were again internally displaced due to weather-related events, which is, if you break it down, nearly 26,000 displacements involving children each day. Now, obviously, this is sort of breaking it down to last year, but what does the world look like? Well, we know that around 500 million children live in the world in areas already at high risk of flooding. 160 million are exposed or live in areas at severe risk of drought. And as you dig deeper, you only need to look at 2 countries to see what that means. So let's first go to Bangladesh. In Bangladesh, we have 12 million children that live near river systems at high risk of flooding, 4.5 million children living in coastal areas regularly struck by cyclones, 3 million children living inland in farming communities that regularly experience the impacts of drought. So for 20 million children in Bangladesh alone, climate change is a reality today. They're not waiting for it to happen in the future. It happens every single day. Let's go to the other end of the world. In Guatemala, in the past 6 years, already food insecure communities have suffered another 6 years of drought, especially and among the indigenous community in Guatemala, the malnutrition rate is 70%. Across the region, 80% of 12-year-olds do not attend school. And the pandemic thrust another 1 million Guatemalans into poverty. Now, are we surprised then to see and to hear in interviews with migrants that either prepare to leave Guatemala or those who have already recently arrived in the US, that the majority of them mentioned food insecurity as a key factor in their decision to leave? Now, having said this, we also know that the impacts of unsafe mobility or the lack of pathways and the chaotic urbanization that we often see in many contexts due to climate-induced changes in the environment, they already strain health systems that are weak. They bring them to their knees. And the pandemic last year, in a way, put a spotlight on this. So in many countries, already strained healthcare systems are put further on strain as people move. And obviously last year, as we had already heard, we have seen this play out in the condenser. In some cases, routine immunization was disrupted. In other cases, services that address severe acute malnutrition in children dropped, sometimes 80%. Lots of children missed out on routine healthcare, with thousands likely risking their lives. We also know, and this is again just to be very concrete, that those cities that are most affected and that, like Dhaka, for example, in Bangladesh, receive up to 400,000 new low-income migrants each year, the urban slums today do not have public health clinics. 93% of Dhaka slum areas do not have public health clinics. So again, no surprise that diseases like dengue fever, diarrhea, make an easy comeback. It doesn't even take a pandemic like triggered by COVID-19. Every day, children under 5 die of diarrhea, which continues in the world to be the leading cause of malnutrition and the second leading cause of death for children. So while migration and climate change is happening, our migration laws have not kept pace. They're just simply not fit for receiving or providing protection or realizing the rights of environmental migrants. So what does it mean? So this is where I want to just jump into 4 steps that, from our point of view, are critical. So what needs to happen? First, we need to map, plan, and prepare. Second, we need to strengthen health systems. Third, we need to innovate, adapt our migration governance and tools. And I know there's a lot of discussion already about how to recognize environmental migrants. Well, let's not talk about it, let's do it. And then last but not least, we need to work and support and partner with young people. Not just because it's nice to have, but because it is essential to achieve that turnaround that I think many of you have already spoken about, that we are staring at a disaster in the making. And I am convinced, we are convinced, only with young people are we able to mobilize the action that is needed. Now, first, map, plan, prepare. The lucky aspect of climate-induced migration is that it doesn't just happen. It's mappable. We can actually pretty closely predict which are the areas where most people will be pressured to leave from, which are the cities and the coastal areas and the countries where, studying patterns of today, many people will likely move to, what kind of skills may be required, and what kind of health infrastructure is needed to absorb and receive and provide services to these new migrants. So, for example, in the Indonesian context, the Indonesia Disaster Risk Index map is already being used to combine technology and basic education data to map out which schools and students are located in disaster-prone areas. And we are currently in process of actually expanding this to also map out the health facilities infrastructure to assess them in terms of vulnerability to disaster. But we can also invest more in innovative data sources to collect better information on how children and where children will be affected by climate change-related displacements and migration. So in rural Pakistan, for example, we are already using satellite imagery and survey data to forecast migration patterns to better understand the relationship between weather and migration movements. But this also means to map, to plan, to prepare, we need the right people around the table, including the urban planners, the policymakers, the healthcare providers, so that we can not just anticipate population flows, but then also act. And again, another example is maybe worth mentioning here in Freetown in Sierra Leone. The city itself will double in population due to migration, urban migration. But already the mayor there has actually put together a program called the Waste Management Micro-Enterprise Program to promote economic livelihoods by creating jobs, improve the sanitation situation, and build environmental resilience, working specifically with migrant youth to strengthen waste collection services in informal settlements. This program, since its launch, has extended waste collection services from 8,000 households to 30,000 households. So these examples just show it's possible, it's doable, even in low resource environments. Now, secondly, we need to strengthen the health systems, make them more resilient. This has already been said by many of my co-panelists. So let me just very briefly recap what it means. So in the short term, now, we need to ensure no child or family is excluded from healthcare services because of their migration status. This means putting in place firewalls between health and immigration services, because if children, migrant children or parents are afraid to be detected and deported, they will not get a COVID test, they will not get their vaccine, they will not seek healthcare. We specifically need to strengthen risk communication strategies to also reach the most vulnerable and also address vaccine hesitancy among migrant communities. And obviously, we need to strengthen our ability to deploy mobile health facilities that can provide integrated health and nutrition services, equipped with child health specialists that can be deployed during and after disasters, including during pandemics like today. And in the long term, obviously, invest in the resilient health infrastructure, build capacity of healthcare workers, expand coverage of universal health coverage, specifically in informal settlements, or advance also the digitization of medical records, because only this way we can actually prevent the loss of health records and support a continuum of healthcare, and champion child-friendly disaster risk reduction and preparedness. Again, strengthening the disease surveillance, early warning systems, and deliberately prioritizing sensitive infrastructure like healthcare, schools, and other services. Now, thirdly, as we know, our current migration governance and tools and pathways are just simply not fit for purpose We need to expand and reform them. It has already been said, migration is the safest coping mechanisms in many contexts to mitigate the risk of climate change for children, young people, families. It is the adaptation strategy that is yet unexplored. And we can invest both in skills and pathways that combine retraining, upskilling, mobility, productive migration, anticipating the needs, designing new smart skills partnerships, and creating a win-win. A win for those who need to move or want to move, a win for those communities and economies who receive them, and both manage our labor market needs and manage the transition to a low carbon and climate resilient economy. The Australia Pacific Training Coalition is already showing us the way how to do it. It's a network of 5 technical training centers. It has already trained around 12,000 young people in vocational subjects like hospitality, construction, and others that focus on skills both needed in migrant origin and destination countries. UNICEF's partnership with Microsoft and the University of Cambridge around the Learning Passport is another tool we have at our disposal to create portable, mobile learning, so children can learn where they are on the move and take the learning with them that is being recognized. Last but not least, it is not a luxury. It is essential to success that we partner with young people, which means we need to proactively empower them, work with them, invest in them, engage them. So in Guatemala, for example, UNICEF, we're working with Paz Joven, a youth organization that is leading the way on resilience efforts and supporting evidence-based municipal adaptation and mitigation plans. Or in Belize, we work with young people and children to reduce the impacts of air pollution and reduce emissions and create greater awareness. In Bangladesh, the youth organization Youth Net for Climate Justice works day and night to address climate change and prepare citizens to be more resilient, mobilizing communities, building capacities, monitoring disaster risk reduction, and leading efforts to adapt to climate change. Now, in conclusion, I want to introduce Tashin. He is a 22-year-old climate activist from Bangladesh. He always visited his grandfather, whose house is near a river. There, Tashin learned firsthand about the impact of climate change and river erosion. As a youth journalist, he started to raise awareness about how climate change is impacting children. In 2015, he founded the Lal Sabu Society to raise awareness. In 2019, Tashin attended the UN Climate Summit for Youth, and he works day and night connecting youth activists around the world and working with local governments to actually drive solutions. Speaking to him recently, he said, "I have always believed in action, and I always want to make sure that I'm not the only one talking about it, that thousands of other people in my country like me are talking about climate change." Now, let me thank here our colleagues and our partners, IOM, our hosts, my co-panelists. We have talked about it. And obviously, let me now hope and conclude that this talk is not just to remain talk, but that it will be followed by action in partnership with young people, and that we are better prepared. We know the solutions. We just simply need to get action going. Thank you.
Thank you, Verena, for sharing these perspectives on children and this panoramic of issues affecting children in different spots of the world, as well as the areas we need to invest on. We have seen it in IOM ourselves, in our work, on how an impact or measure in one area of work has an impact on another area of work, and how you have to connect these and bring expertise together. And thank you for introducing Tashin. These children are the adults of the future. So by partnering with young people, we will invest and plan and prepare for the future. So it is a very important point that you leave us with. So thank you. And now I have a few speakers from the floor, sorry. And we'll go back then to the panelists later on. I would like to give the floor to Ms. Aurora Diaz, permanent representative of Spain. The connection is through Emilio Contreras Benitez. So then we'll move on, I guess, with the next speaker. And when
we'll try again with them later.
Okay. Okay, then we have the next speaker is the Deputy Permanent Representative of China, Ms. Meng Xiaowan, Deputy Director General of International Cooperation.
Thank you, Ms. Director. Thank you. China fully supports the dialogue. National Immigration Administration, or NIA of China, treasures this opportunity to attend this very important platform of discussion. Thank you for all the speakers and all those speeches and interventions are very impressive. We think that this dialogue helps all the stakeholders have a better understanding of the linkages between migration, environment, climate change, and health, and enable us to better identify challenges and opportunities. More importantly, encourages the development of reasonable initiatives and solutions. I would like to take this opportunity to share 3 points based on China's experience and practices. First, to take a people-centered approach. In this very challenging moment, NIA has taken serious measures and policies to uphold the well-being of migrants, protect their legitimate rights and interests, and provide them with quality immigration services, including launching China Immigration Service Hotline, an official English website, and provide urgent visa and travel documents services for travelers in need. We also strengthened cooperation with relevant countries by timely sharing information, providing medical supplies, assistance, and aid, and also facilitating essential international travels. We believe that all measures and efforts helpful for the COVID-19 recovery and benefit the long-term economic and social development and the well-being of the migrants should be encouraged. And to improve migration governance, climate change, health crisis, and migration are interconnected global issues calling for improved governance. It is important to address the above complex issues in a systematic, law-based, and integrated way, and root causes must be properly handled and addressed. The whole of government, multi-stakeholder approach, and coordinated policies and plans need to be formulated and implemented. Thirdly, to enhance cooperation, the importance of solidarity, cooperation, and joint efforts cannot be stressed enough. We suggest that countries concerned to conduct pragmatic cooperation. Disagreements and disputes be managed and solved through dialogue and consultation. Multilateralism, international law, and rules formed and recognized by the international community be respected and followed. Effective global frameworks such as GCM and the 2030 Agenda on Sustainable Development be fully implemented based on each country's unique situation. Guided by the vision of building a community with a shared future for mankind, China is committed to work closely with all countries and international organizations to address the global challenges. Thank you, Mr. Director.
Thank you, Ms. Deputy Director General. And I see the permanent representative of Spain is online. So, Ms. Díaz, you have the floor.
Muchísimas gracias, directora, y muchas gracias a los participantes en el panel por sus interesantes comentarios, de los que tomamos debida nota, en particular su llamamiento a la acción, a una acción urgente y a la cooperación. El fenómeno de la movilidad humana no ha escapado a las consecuencias del cambio climático. Este vínculo incluso es cada día una evidencia más clamorosa. Bajo ciertas condiciones es o puede llegar a ser el detonante de desplazamientos forzosos e involuntarios, pero también puede tener un efecto multiplicador o involuntario en la decisión de emigrar que tomen grupos o individuos. Hasta ahora, El cambio climático, en términos amplios, ha tenido un impacto directo en la movilidad, principalmente bajo la forma de desplazamientos internos dentro de las fronteras de un país. En otros casos, se identifica como la raíz misma de los movimientos intrarregionales. Pero si no se hace frente al cambio climático en un futuro próximo, como bien han puesto en relieve los panelistas, este puede provocar movimientos migratorios masivos e involuntarios, desde luego internacionales e incluso intercontinentales, o al menos aumentar esta tendencia. Esto ya es visible en el caso de los pequeños estados insulares, pero no únicamente. En muchas regiones, como el Sahel, afectaría principalmente a personas especialmente dependientes de los ya escasos recursos naturales, lo que añade complejos desafíos socioeconómicos con fuertes vínculos a la seguridad y a la cohesión social. El Pacto Global para una Migración Segura, Ordenada y Regular incluye en su objetivo 2 la necesidad de afrontar entre todos el cambio climático como un motor de migración involuntaria. Todos estamos de acuerdo en ello, pero ¿cómo respondemos a este desafío de forma efectiva y eficiente? ¿Cómo podemos incidir directamente sobre los vínculos entre migración y cambio climático? ¿En foros de debates, con estrategias y acciones, o más bien de forma horizontal en marcos de regulación del cambio climático como en la COPs? Probablemente se debe hacer de las dos maneras, pero lo importante es determinar el tipo de acción más adecuada y el enfoque más eficaz. Primero, quizás deberíamos distinguir los casos en los que el cambio climático genera en sí mismo vulnerabilidades humanas que obligan a migrar, de los casos en los que el cambio climático opera como un elemento más que se añade a vulnerabilidades ya existentes. La posibilidad de adoptar medidas temporales de mitigación o adaptación o la necesidad de proponer soluciones definitivas es otra cuestión que se debe tener en cuenta a la hora de elegir el rumbo mejor de acción. Generalizar el uso de términos nuevos como migrantes climáticos o refugiados climáticos no es necesariamente la mejor manera de afrontar el desafío. Puede añadir confusión y tiene el riesgo de rebajar el estatus jurídico que ya existe en el derecho internacional respecto a conceptos consagrados. Por este motivo, resulta tan oportuno el poder intercambiar opiniones sobre cómo actuar en el contexto de la próxima COP26 y por ello agradecemos enormemente a la OIM la elección de este tema para estos debates migratorios. En cualquier caso, con todos los factores que impulsan la migración, no podemos afrontar el cambio climático sin cooperación internacional. Y en eso han sido muy claros los panelistas en esta segunda jornada. España cree firmemente en la cooperación internacional en todas sus formas, multilateral, regional y bilateral, como declaró el presidente del Gobierno, Pedro Sánchez, en su discurso en la Conferencia Intergubernamental de Marrakech que adoptó el Pacto Global. De hecho, y desde hace décadas, España basa sus políticas nacionales migratorias sobre una verdadera cooperación sincera, eficaz y beneficiosa para todos con nuestros socios europeos, con nuestros socios latinoamericanos, mediterráneos del sur, subsaharianos y del África Occidental. Estamos convencidos de que la migración es una tarea común que nos concierne a todos, independientemente de que seamos países de origen, tránsito o destino. Nuestra preocupación es centrarse en las personas. Debemos cooperar para reducir y no aumentar su vulnerabilidad. Estamos orgullosos de nuestro enfoque humanitario y continuaremos aplicándolo. La migración debe ser correctamente gestionada. No puede ser abandonada a su suerte. Solo un enfoque global y multidimensional puede ser eficaz para luchar contra la inmigración irregular organizada, para promover nuevos cauces legales razonables para la migración y para ser eficiente en la solución de las causas profundas de la inmigración involuntaria. Solo mediante una cooperación verdadera y de buena fe nos acercaremos al objetivo del Pacto Global de hacer que la migración contemporánea sea más segura, más ordenada y más regular. Muchísimas gracias.
Muchas gracias, señora embajadora. I will now give the floor to the Holy See, Monsignor John Putzer, First Secretary. You have the floor.
Thank you, Chair, and thank you to each and every one of the panelists for their interesting and illuminating interventions. Chair, the dramatic lessons from the ongoing pandemic shed a new light on the interdependence of the human family, and in particular on the need to consider health as a primary common good. In this regard, as there remains an alarming and expanding inequality in the global distributions of COVID-19 vaccines, Pope Francis affirmed that we cannot allow the various forms of nationalism closed in on themselves to prevent us from living as the truly human family that we are. For this reason, he has appealed for vaccines to be made available and affordable to everyone, and to facilitate distribution, especially in the poorest countries. Indeed, justice, solidarity, and inclusiveness are the main criteria to be followed in order to meet the challenges posed by the pandemic. In this regard, this delegation wishes to underline that the Global Compact for Safe, regular, and Orderly Migration calls on states to incorporate the health needs of migrants in national and local healthcare policies and plans. Indeed, the Global Compact on Refugees calls on states and relevant stakeholders to contribute resources and expertise to expand and enhance the quality of national health systems to facilitate access by refugees and host communities. Chair, all too often migrants are not seen as entitled like others to participate in the life of society, and it is forgotten that they possess the same intrinsic dignity as any person. It is regrettable that, amidst the pandemic, many migrants have become even more vulnerable than they were previously. Even more concerning, those who find themselves in irregular situations out of fear of being detained or deported often hesitate to seek medical care. Rather than being a privilege, healthcare should be accessible and affordable to all, including those in vulnerable situations. Access to healthcare should never be instrumentalized politically or ideologically. It should be regulated through non-discriminatory, comprehensive laws, policies, and practices firmly rooted in the inherent dignity of human life at every stage, that is, from its beginning, through its development, and up to its natural end. Chair, if there is no doubt that climate change is a reality that is increasingly contributing to the decisions of millions of people to forsake their home and face the perils of displacement, then there should also be little doubt over the impact of climate change and environmental degradation on health. As Pope Francis has said, the world will emerge either better or worse after the pandemic. What is certain is that migration, whatever its triggering factors, will be playing an ever-increasing role in our societies. Therefore, mindful of the dramatic lessons learned from the pandemic, it is now the time to rethink the parameters of human coexistence through the lenses of human fraternity and solidarity. Thank you, Chair.
Thank you, Monsignor Putzer, for these contributions. I will now give the floor to Ms. Eulalia Tabares, General Director of Consular Relations of Venezuela.
Muy buenos días, buenas tardes. En ocasión de este importante espacio de diálogo internacional que abordará temas sobre la migración, el medio ambiente y el cambio climático, reciban todos un cordial saludo en nombre de nuestro presidente de la República, Nicolás Maduro y nuestro canciller Jorge Arreaza. Expresamos nuestro más sincero agradecimiento a la Organización Internacional para las Migraciones por desarrollar espacios como este en el cual tenemos la oportunidad de abordar temas en especial importancia en la actualidad como lo es la migración, el medio ambiente y el cambio climático en el contexto de la crisis sanitaria presente por el virus del COVID-19. En principio, y en primer lugar, me permito comenzar haciendo referencia a la erupción a comienzos de 2020 de la pandemia asociada al COVID-19. Esto supuso un impacto considerable para el planeta entero, especialmente para la movilidad humana, tal cual se había conocido hasta entonces. Hubo un cambio, hubo una irrupción. La pandemia nos ha dejado una clara fragilidad y ha visibilizado esa fragilidad en nuestras fronteras para detener el avance de una enfermedad que no discrimina. Y aunque Venezuela presente uno de los indicadores estadísticos de menor tasa de contagios y de menor índice de mortalidad, la COVID-19 nos ha confirmado que es imposible una solución aislada o unilateral. Por el contrario, urge cada vez el fortalecimiento de la cooperación internacional y el multilateralismo para hacer frente a este tipo de escenarios pandémicos. La República Bolivariana de Venezuela aboga por fortalecer el papel de los organismos internacionales, como la Organización Mundial para la Salud, y de los programas como el COVAX, que buscan garantizar el acceso equitativo a las vacunas. El COVID-19 además dejó al descubierto la enorme vulnerabilidad a la que está expuesta la población migrante en tiempos de pandemia, por lo que sin duda el llamado del Estado venezolano es a que al menos en estos contextos pandémicos todos los países se comprometan a garantizar la universalidad de acceso a los derechos a la salud independientemente del estatus jurídico de la población migrante. Sobre el particular, cabe destacar que el Estado venezolano en la atención a sus migrantes ha estado desarrollando e implementando el retorno voluntario a través del Plan Vuelta a la Patria. Desde el año 2018 ha alcanzado un total de 24.579 repatriaciones en 143 vuelos gratuitos, procedentes de 16 países, priorizando, por supuesto, niños y adolescentes, los cuales hemos logrado repatriar solos y acompañados, ejecutando 120 repatriaciones y reunificaciones familiares. En el tiempo de la pandemia se han hecho efectivas, solo en pandemia, 6.502 repatriaciones a través del Plan Vuelta a la Patria. evitando de esta manera que los connacionales queden expuestos en los países donde se encontraban en medio de confinamiento. Por otra parte, como arreglo a lo anterior, para prever los riesgos de propagación de contagios, el Estado venezolano instaló puestos de asistencia sanitaria integral a la disposición de los connacionales que retornan vía terrestre a través de los puestos fronterizos. Venezuela pone a disposición esta experiencia a los países aquí reunidos de gestión de los puestos fronterizos durante la pandemia, en los que, siguiendo las recomendaciones de los organismos internacionales y con la conformación de equipos multidisciplinarios, se logró garantizar una atención médica de calidad y, a su vez, contener la propagación de contagios con la detección temprana de los casos positivos de personas en tránsito, lo que hoy nos permite exhibir una de las mejores gestiones del virus a escala regional. Nuestro país hace votos para avanzar en la mejoría de las coordinaciones bilaterales y regionales en esta materia, con la intención de que prevalezca el interés superior de las personas migrantes. Para concluir, en coherencia con lo anterior, la República Bolivariana de Venezuela participó en la elaboración de la guía de prácticas para la protección para personas desplazadas entre fronteras en contextos de desastre. Esto fue en el año 2017, siendo efectivamente aprobada en el año 2019. Y se pudieron generar insumos necesarios para desarrollar lineamientos regionales en materia de protección de personas que se desplazan entre fronteras en el contexto de desastres para ser adoptados en el marco de los trabajos de la Conferencia Suramericana sobre Migración. Contamos con un país que está a toda la disposición y colaboración, y saludamos el esfuerzo multilateral para lograr los esfuerzos y concretar éxitos al respecto. Muchísimas gracias.
Muchas gracias, señora directora. I now have still 3 speakers on the list and 3 minutes to go, no, 2 minutes to go. And I would like to give back the floor to the panelists for some concluding words before we close. So I would like to ask you to be as brief as possible. I will give now the floor to to Ms. Chiara Maria Paolucci from the Istituto Italo Latinoamericano, ILA, who is a principal expert of the program Eurofront. Ms. Paolucci, you have the floor.
Okay, do you listen to me? Thank you for giving me the floor. It's a real honor for me to participate in this context with such high-level speakers and on such an important subject. I am Chiara Maria Paolucci, an Italian magistrate, currently a key expert in Eurofront, a European Union program run by ILA, International Italo-Latino-American Organization, which I am representing today, and by IOM and FIAP. In the work we are carrying out in Eurofront, which objective is to allow the best mobility of people, ensuring the respect of human rights in migratory border controls, at the same time ensuring a more effective fight against cross-border crimes, emerged the importance of prediction and prevention of migratory phenomena in order to face them promptly and properly. In early warning, prevention, and early action could effectively help to assure the respect of migrants' human rights. To this end, a wide-ranging debate has been opened in relation to the most useful tools to prediction and prevention of this phenomena, not least the use of artificial intelligence systems. In relation to the interesting and important interventions that I have listened today, my question is how are migratory issues dealt with as far as prediction and prevention are concerned? What tools do you think are useful? What do you think could be the best way to predict and prevent these phenomena? I know that the topic has already been covered, but I would be grateful if it could be explored further. Thank you so much.
Thank you, Ms. Paolucci. I would like to give the floor now to Mr. Alfonso Lages from Portugal.
Perfect. So, Excellencies, dear colleagues, as this is the first time I am taking the floor in this year's IDM, allow me to warmly welcome the dialogue's return to New York, albeit virtually, and to thank also the panelists for their insights today. Portugal organized an event on the very topic discussed in this year's IDM during the GA High-Level Week in 2019, and even then, climate-related migration and displacement was already a very tangible and global problem demanding multilateral solutions. Now, there are significant differences in the interplay between COVID-19 and migration and between climate change and migration. The responses to the first one often created more barriers to mobility, whereas the second one is triggering migration and displacement at staggering speed. However, I believe that some of the principles that were used in our response to COVID-19 can be of use to address the nexus between climate and migration. I'll mention two of them. The first one is that including all groups and persons in vulnerable situations is the best way of making the response as effective as possible. Not only because a human rights-based approach should guide us, but also because this is what makes public policies truly far-reaching, comprehensive, and effective. This was our experience with COVID-19 when we granted residency rights to all irregular migrants and asylum seekers, covering around 250,000 people, granting them access to social and health benefits, to free diagnosis, treatment, and vaccination against COVID-19, regardless of migration status. The second lesson I would draw from COVID-19 is that we should look to the GCM. Climate-related migration is very much contemplated in the compact across different objectives. So in line with the GCM, I would point out to the need to accelerate climate mitigation and adaptation efforts and to scale up joint analysis and planning. Planned adaptation is of the essence when it comes to ensuring that people aren't forced to move. And so we take adaptation very seriously, including in our bilateral cooperation and in the context of this semester's Portuguese presidency of the EU Council. As a champion country of the GCM, I would add that this is the beauty of the compact. All dimensions are there. So we do not need to reinvent the wheel. We just need to implement it. Thank you very much.
Thank you very much for these comments. I will now ask Mrs. Leila Yor Santos from the Philippines to take the floor.
Yes, good morning, everyone. First of all, I'd like to thank IOM for this very critical dialogue. And I'd also like to thank the panelists for all their insights to this during this meeting. I think I'm particularly pleased to note that there is a recognition of the Philippines as one of the most adversely impacted by the effects of climate change, migrant sending country, as well as a champion of GCM. This discussion right now is really crucial to our country. For the Philippines, the migrant sector has been one of the worst hit by the pandemic, impacting the health and livelihood of hundreds of thousands of overseas Filipino workers and their families. On one hand, many migrants suffer from lack of access to health, services, and exclusion in their host country's response to the pandemic, inadequate living and working conditions, and limited local knowledge and networks. They also face xenophobia and discrimination. On the other hand, migrants are taking on a critical role in the front lines. Filipino workers, nurses, working overseas have paid a great cost, some with their very lives, while Filipino seafarers remain stranded at sea during the height of the COVID-19 crisis. The migrant sector makes up a significant share in workforce in sectors that have remained open during lockdowns. They are thus disproportionately exposed to health risk posed by the pandemic. It is in this context that my delegation has strongly advocated and continues to advocate for the inclusion of migrants, irrespective of their migration status, in national vaccination plans and recovery programs of both destination countries and origin countries in case of their return. We also firmly support the implementation of the Global Code of Practice to ensure that the needs of the domestic health system is not unduly undermined by irresponsible migration of skilled and professional health workers. In the interest of time, I will not go in the national initiative that we have taken. Our Vice Minister for Migrant Workers will further elaborate on this in the session tomorrow. However, I would like to recall the adoption of the WHO, or the Global Strategy on Health, Environment, and Climate Change in 2019. And for this, I would just like to request a panelist from the World Health Organization to perhaps briefly provide us the key findings and recommendations of this strategy, particularly on capacity building and financing for developing countries and migrant sending countries. Thank you very much again, Chair.
Thank you very much for this intervention. And I would like now to give the floor to our last speaker, who is Professor Mizan Khan, Deputy Director, International Center for Climate Change and Development. Professor Khan, you have the floor.
Yes, thank you very much for allowing me a little flow for a few minutes. I'm a university professor, but I'm also a long-time negotiator under the Bangladesh delegation to the UNFCCC process. So I follow these loss and damage negotiations. And as I have shared also yesterday some of my thoughts in this chat box. Here I mention about two perspectives to look at climate-induced displacement. One is pure security lens, as kind of a threat multiplier, which is absolutely an injustice to these climate displaces. The perspective or lens that we promote is vulnerability-focused human security, and adaptation is the only way to ensure this human security with adequate support. And then, if we look at the UNFCCC negotiation progress, then Para 14F of the Cancun Adaptation Framework was a great decision. Just in 3 or less than 4 lines, we have 3 types of actions there. 3 types of human mobility, displacement, migration, and planned relocation, 3 scales of action at national, regional, and international levels, and 3 types of actions also, cooperation, coordination, and research. Okay, but then again, we have started backtracking through establishing under WIM of this task force. And for years, they are recommending, they are doing and busy with making recommendations, which doesn't have any teeth. So I think if we really want to make progress under the GCM, as well as also under the UN Framework Convention on Climate Change, then let us get back to this Para 14F. Then we can have real, and Bangladesh, for example, has a clear internal displacement strategy, how to cope with. And there, from our office, we are trying to promote migrant, climate resilient, migrant friendly cities. Because in populous nations like Bangladesh or India, for example, or in Pakistan, we don't have much space to retreat. So one option is to create climate resilient, migrant friendly secondary cities away from large cities, because everybody moves to Dhaka. Bangladesh is a capital-centric country. So this is one thing we are doing. And just for the upcoming Science magazine, an important article written by me and Dr. Selim is coming up, I think in next week or 2 weeks. There we have argued for displacement, how to handle displacement in populous nations. There one option, as I have mentioned, establishing climate resilient, migrant friendly cities. And the other option that I have argued for is selective relocation abroad. Because this planned relocation abroad has got many connotations, both the anti-immigration perspectives and all those. But Bangladesh's strategy clearly advocates that selective relocation in the sense of young members from the displacement hotspots, if they are allowed to move to the countries with demographic deficits. Many European countries have demographic deficits with labor shortage, and they can go there with they can get training first in supported institutions in Bangladesh, and they can move even to on a temporary basis, which IOM supports. And then the left back members of the family, such as the elderly and the old and the spouses, can be supported by the remittance. I can cite one just example. In 1917, about $460 billion of remittance was received by the developing countries. And these migration, in fact, I never met an article or literature anywhere which depicts a negative perspective on migration from economic point of view. It contributes to economic growth, labor mobility, and also revenue generation, both for industrial countries as well as for the developing countries. So I think we need to look at this, at least selective relocation of young and able-bodied, well-trained labor force to developed countries with demographic deficits. Thank you. I have many things to say, but because of shortage of time, but please look at our science perspective piece very soon, in a week or two. Thank you very much for allowing me the floor.
Thank you, Professor Khan, for this intervention. We are very late. There is questions in the chat, and I don't know if the panelists can attempt to answer some of these questions. In a normal setting, we would have, either the breaks, or we could meet and panelists could chat, but we don't have that now. And I would like to ask each panelist, unfortunately, Dr. Abubakar had to leave, but I would like to ask the other panelists if you would leave us with a key message, very short key message that we can take to COP26 or the IMRF, the International Migration Review Forum in 2022. What would that be? Very shortly. And maybe we can start in the order that we started. Dr. Marianera, if you're still with us.
Yes, I am, Monica.
Yes, you are.
I am.
Good.
And I've been following the debate with a lot of interest. Definitely, we need to be very strong at the COP26. I think the message is that climate change is already creating displacement, is already creating migrants, and we are very concerned about the health services that needs to be provided and the health systems resilience. So we will insist on the two things, no secrets, on adaptation and being able for the health systems to cope with that and be better prepared to respond to those needs and responding to the services that the migrants will need, but at the same time, mitigation of the causes of climate change, which will be containing the need for the people to migrate. So we need you, and definitely we are very happy to collaborate and to join forces with you for these strong arguments to be presented at COP. Philippines raised an issue, a question, but I'm so sorry that I will not have time to go into detail. It would be fair for others, unfair for others, but maybe the message about this global strategy that she mentioned is prevention, prevention, prevention. So happy to discuss that at another occasion, but this is the key message: prevention, 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 and co-benefits for all of us if we tackle the causes of climate change. Over. Thank you.
Thank you, Dr. Neira. I will now ask Mr. Tamas, Kristof, your key message.
Yes, thank you very much. My message would focus on what IPCC showed, that climate change could negatively affect factors that are known to increase conflict dynamics, for example, poverty, economic shocks. And there are also studies that have shown a relationship between climate variation and conflict. But we should keep in mind that there are disagreements about whether climate change directly causes violent conflict or not. But in any case, climate change and environmental disasters should be regarded as threat multipliers related to security risks, and the UN should devote more attention to the interlinkages. And since Bangladesh was mentioned, I just want to give that country as an example also of the other point I would like to raise about the need for international cooperation and the capacity building and cooperation between donors and developing countries. Because Bangladesh is one of the countries in the world most exposed to both climate change and environmental disasters. Effects of urbanization and industrialization have led to environmental damage, pollution, depletion of natural resources, This also affects the Bangladeshi economy, which loses about 3.4% of GDP each year due to environmental degradation. There are environmental health risks due to pollution, almost 28% of all deaths. And also we have the more long-term impact of rising temperatures. The Himalayas will be affected with melted glaciers. We need to address sustainable solutions for cross-border water resource management. The riverbank erosion in Bangladesh is also well known, affecting many people each year, also leading onward to more poverty and exclusion. So we need to address all these issues in an integrated way and increase our joint efforts and international cooperation. Thank you.
Thank you, Kristof. And our next speaker was Dr. Ferris. Elizabeth, your key message?
Thank you. I mean, I think this has been a really good discussion, but we need much more research. We need many more discussions, and we have to recognize the complexity of the reasons people move. You know, sometimes it isn't so clear what's displacement and what's voluntary migration. There's a lot of gray area in there. And finally, I think we need to look at some of the good practices. Just as climate change is already leading people to move, so too we've heard even in this panel some good ideas of mayors, of local communities, of young people who are taking action now to prepare for larger scale migration that's likely to come. Thank you.
Thank you, Elizabeth. And finally, Verena, Knaus. Verena?
Thank you very much. It's hard to add much, but maybe just to recap, I think it's been very clear that everyone agreed and reinforced the critical importance of preparedness. So there, obviously, the solution needs to be, using the data we have. It's not about so much, the lack of data. It's using and combining the available data we have to actually prepare and to drive the investments into the sort of resilient infrastructure, into the soft spots where we know the disaster will strike and where the action is needed. Everyone also agrees, and I think restated the importance that while everyone is affected by the adverse impacts of climate change, some will be more affected than others, some being most vulnerable, children, most vulnerable communities, but also some countries. So it's a little bit like in the pandemic. We all sat back for a long time and watched until it rolled over our own countries. And I think if there's one lesson that we can learn is to not repeat that mistake again. It comes in one form or another. Thirdly, preparedness obviously saves lives. How many lives could we have saved if we had taken masks seriously, if we had stocked up on masks early on, rather than basically had to resort to lockdown to stop and contain. Now, we all know mitigation of climate change is possible, and it may cost in the short term, but it will be paid back in so many ways. So this is really, I think, the solution or the way forward, or what we need to pack in our suitcases as we go to COP and as we go and get ready for the IMRF, is we need to bring along young people and migrant communities themselves who actually can make the case maybe in a more compelling way than we can. But also we need to find the partners and the alliances that will help mobilize the political action that is really stopping us from preparing, from investing, from sort of forward planning. We all knew the pandemic will be sweeping over the countries. At least the experts knew, but we didn't act. We know climate change is inevitable and it will be differently played out in many countries. And the solutions are really at our fingertips. So while political action today may seem hard, political inaction will be so much harder at the end. So we have an opportunity, and I think we have the solutions. We just need to bring the right people to the table and be partners. Thank you.
Thank you, Verena. Thank you to all our panelists for these last words. We will collect them and we will bring them with us to these important events. And I think we will find a way to go back to our speakers at the beginning in the video. And I thank also all the speakers from the floor, and apologize that there was no time for answering the questions. And apologize also to the next panel that starts 20 minutes late. And I will give the floor now to my colleague Dan, who will introduce the next panel. Thank you very much and good afternoon.